graduated from Western Carolina University with my bachelor's degree in social work. I did an internship at a hospital which combined my social work skills along with a utilization review team. Then I saw a job that was here in my hometown where I was born and raised for most of my life. And so I applied for the position to be a child and family support team school social worker. I thought, wow, now I can actually use this experience because it was working with a nurse. And I'd already had the experience of working with social worker nurse teams, so I knew how I could make that be successful. I am immunocompromised, so my physician and I had been talking about it and what would happen when a vaccination became available. I have a friend who is an epidemiologist, and she studies the trends of diseases, and right now COVID is the main disease that everyone is studying. So she knows everything about COVID, all the ins, all the outs, what the vaccination is, what it isn't. And so I also talked to her personally and got her professional opinion about what would happen with vaccinations and her thoughts about it, which further led me to trust what my doctor and I had decided and to be one of the first people in the school district to go and get the vaccination when it was available. But when I got the first shot, it was on February 1. And so they said, we need somebody who can just jump up and go. And I was like, that's me, I'm already out the door. And so I went, it was simple. I didn't have very many symptoms. I ended up going to work the next day, doing everything I needed to do. But after work, I had an appointment to get my car serviced. And so it made me a little drowsy. So I was in there asleep. And they had to wake me up and say, are you all right? And I'm like, man, it was busy at that school today. Other than that, that was the only symptom I had, just being a little bit drowsy that the next day. Well, my vaccination story helped parents, also staff, but my parents called to ask me anything. Sometimes the questions are easy, sometimes they're hard. And so I might get a question about how much is a library book fine? I might get a question about what to do about any little or big thing. And so they also call to ask health questions. They call to ask what time some events are going to happen. And so some of them called to ask me, what did I do about vaccination? And I couldn't tell them what they should do, but I could tell them about my story and what happened and how I felt and why I chose to get a vaccination. And then they made their own decision for themselves and their children about vaccination.